The month of October has been declared Mental Health Awareness Month with the objective of not only educating the public about mental health, but also to reduce the stigma and discrimination. Children and adolescents face numerous challenges, including individual, social and environmental factors that impact their mental well-being. The COVID-19 pandemic increased the mental health burden for young people. Some 60% of children and youth felt they needed mental health support over the past year. This is according to the latest UNICEF South Africa U-Report poll.
If we look at the landscape of South Africa, who's our most vulnerable and marginalized population group? It is our children. They are subjected to so much violation, so much trauma. And if we look at the Center for Disease Control and Prevention, we are finding that 1 in 6 children between the ages of 2 and 8 years old are presenting with a mental, behavioral and developmental disorder. And what we have seen since COVID-19, mental health has become, it's actually reached pandemic proportions where we are seeing young children as young as 9 years old, subjected to depression, anxiety, and even completing suicide, something that we haven't actually seen in the past few decades, where more and more children see suicide as the way out. And a lot more children are displaying behavioral disorders within the school context, within the home context, where we are presented with, as I mentioned, anxiety disorders, depression, the attention deficit hyperactivity disorder, obsessive compulsive disorders, eating disorders, post-traumatic stress disorder, which is relevant to our context and globally as well, where children are exposed to violence, whether it's domestic violence, neighborhood violence, even global violence in terms of the wars that we are currently faced with, where children are being exposed to this on national media and often not in a position to process that, fearing for their own security and safety, but also looking at the autism spectrum disorder. I think these are a lot of the challenges that we are faced with, and many children, as we speak, struggle with sleeping disorders, struggle with eating disorders. So children are not in a good space because we are seeing that children are often labeled as bad, as mad, as children that are, stupid sometimes, or lazy or silly. And what mental health does, when there's poor mental health, it actually prevents children from developing healthy, positive relationships, but also achieving academically and even socially, where they withdraw, isolate themselves, and manifest concerning and worrying behaviors.